my back sucks. Pretty much my lower back. I had emergency back surgery in 2017. I had 4 herniated discs that they repaired. They did a discectomy and laminectomy. Everything was going good, and then about a year and 4 months later, I was hit by a drunk driver. And it's just been progressively getting bad ever since.
I see. I'm looking at your pictures. I see that they removed the back of the bone and they did a laminectomy and decompression. Is that about right? It seems to me that they did L3, 4, 5, and S1, mostly L3 to 5.
Well, I guess that terminology does sound familiar. So,
okay. No, your pain. My assistant is telling me your pain is up to 10 of 10. Is that about right?
Yeah, when I'm active, so like standing, doing anything like physical, like I've been off since February 19th. I'm in my bed and I'm on my couch. That's all I can do.
And the pain is going down the left leg only or both legs?
Just the left leg currently.
The pain that's going down the leg, that's very important information. Is it in the front of the thigh, side of the thigh, back of the thigh, or all three of it?
All of it. Yeah, it's my entire.
All of it.
Yeah.
Okay, makes sense.
I fell twice in February. It's been getting progressively worse, but like the leg pain is new as of February. I fell twice. It's extreme weakness in my legs. Like,
okay, it should get bigger, and I apologize telling you, you're not a tiny person. That becomes exponentially dangerous because you have to go through more tissue. For that reason, most of my colleagues, if your BMI is above 40, they don't even recommend the surgery. Have you talked to any other surgeon locally?
Yeah, nobody will touch it. Nobody would do anything.
Yeah, I can imagine that. Nobody wants to touch it because you're big and doing 4-level fusion is a big deal. For us, that's the routine things we do. Okay, because you don't cause all the damage on the way of going in. Tell me exactly, what other surgeons tell you about what the solution is? Did they tell you just have to live in pain, or what did they tell you?
They pretty much said you're too fat, go lose weight. And I'm like, how? I can't lose weight walking to the toilet. I can barely walk to the bathroom. Like, how do you expect me to lose weight? And they're like, well, figure it out and come back and see us then. And I'm like, okay. So, I mean, it feels like a death sentence. Like,
yeah, I'm totally with you on that. And that's almost unhuman. You know, how can you lose weight is a vicious circle. How can you lose weight if you cannot walk and do any activities? On the other side, the surgery is exponentially more dangerous if you have to go through more tissue, do that big surgery. Now, what is your BMI? Do you know that?
It was, I think 56 was 56? The last. Okay. I believe 56 or 58 sounds right.
So now, sometimes in the BMI of that range, I'm actually getting images is harder in the surgery, but I have enough experience. I feel comfortable doing that. Doesn't mean I can't give you any guarantee or any kind of, that the surgery is risk-free. It is not. Every surgery has its own risk. And obviously, if you have a higher BMI, after the surgery activity, you're putting more stress on those hardware. That's always a risk factor. So your surgery is an option, definitely. And it seems you have maximized conservative therapy. And I have the feeling my colleagues never questioned that you need a surgery. They just couldn't offer it to you safely. Is that about right?
Right. I just wish they would have been open and honest about that. Like they were never, it was just like, at the last minute, like, oh, you're too fat, bye, as I'm being discharged. Like, sorry, we can't help you, Yeah. You're the fourth surgeon I've spoke to.
So what did the other 3 surgeons tell you?
Just those things. One said, I wish that you would have had me before you had your first surgery. He said I would have operated on you. But he said, now with your weight, I wouldn't touch you with a 10-foot pole. And then the other 2 are just, you're too overweight.
So let me tell you, I can help you. Okay?
Say the word, give me a date, and I will be in Minneapolis.
So, I have to put you through a process, though. I'm very proud of my results. But my results come from a very conscious and deliberate kind of protocol. Okay.
Now, I've done a lot of research on you. I admire your work, and I trust you. So
probably what you have been going through. You need to encourage those surgeons to just come and learn it the way that they don't have to massacre your back to get the job done. We can learn it. That's surgeon. They can learn it, but these surgeons get so busy, we don't want to take time off to do that. And your story that you said, how am I going to lose weight? I mean, that is a question for many people. And the fact that the two of them, they just look at you and just tell you go away, and the other one says, "Oh, I wish you would have come for the first surgery." That is more or less, is an empty excuse. Okay, so the situation
I agree.
and I think we need to get the awareness out there that there is an option.
My concern is getting him there. Do we drive? Should he fly?
No, fly. Don't drive.
Fly.
Driving all that way, all those bumps on the road is going to make you miserable. You fly, but just make sure you don't carry luggage or somebody else is with you. Somebody else have to be with you. And you have what we call a concierge. We put you in our place. Every day you are here, my nurse will check on you.
Thank you.
Okay, great.
Thank you very much.
Thank you so much. Okay?
So first, I would like to ask you permission to use this video for educational purpose and for internet.
Of course, yeah.
Now, tell me about how do you feel?
I feel great. Like, I've had back surgery before and it was nothing like this. Like,
Yeah.
I feel capable of moving. I was able to move mainly unassisted by the hospital staff. They were shocked that I could move so well, and I feel really good.
Yeah. Now, the last surgery was a laminectomy,
Yes.
and that was when?
2017.
So 3 years ago, and you were how much did you weigh then?
Around 400 pounds.
And now you're about 500. So
Yeah.
your BMI is 62.5.
Yeah.
So, and you have to come a long way to Minnesota to get this surgery done.
Yeah.
Why?
Because the surgeons in Ohio just wouldn't do it. They said I was too overweight and told me to just lose weight and come back. And I was pretty much paralyzed, like so I couldn't lose the weight. So I came here to Minneapolis, and it was well worth the trip.
Yeah. No, the surgery just was yesterday.
Yeah.
And we did that surgery in 1 hour and 55 minutes. We did L2 to S1 olive procedure, transcambin fusion, and before the surgery, now our surgery, we lost only 50 cc of blood, and my part was less than 2 hours.
Nice.
It was a big deal because dealing with all the periphery, that even putting the tube down your throat and so on, that is a big deal. And generally, I think how was your day today?
Oh, it was good. I ate breakfast, lunch, and dinner. Quality-wise, feel good.
Did you go for a walk?
I did. I walked like 5 different times today, and immediately I was nervous that first time, and
Yeah, it feels different.
it does, but nothing like it was way better than what I thought it was. I thought it was going to be much worse, and it wasn't that bad at all.
Before the surgery, you had leg pain. Where was it?
It was in my left lane, and go all the way down my left
Yeah,
lane.
to the foot or where?
All the way to my big toe.
You get big toe.
Yeah,
Not the back pain. How is that pain that was going down the leg?
it's gone.
It's gone.
It's completely not even. And it even feels. Even my leg string feels stronger today.
Yeah. Well,
So-
we opened up this space by putting those spacers, or we put 4 cages, 10 screws, 2 big rods.
Okay.
And from my side, actually, even though considering that we had to, because of your weight, we had to keep the tube in last night in the ICU so they can breathe you.
Right.
That has less to do with my procedure than the idea that we have to just make sure your lung get enough blood by laying just on that, even for 2 hours.
Right.
But they took the tube out, was no problem.
Yeah.
Besides that, I would have let you go home today.
Right.
But
Yeah.
I'm just going to keep you over the night. And do you feel ready to go out
Yeah.
of hospital?
I feel like I could be at home or in the hotel. Yeah,
Yeah.
definitely.
I'm not going to lie to you, it was a difficult procedure because we have to make many things work for you, like the C-arms, the machines that get x-rays, and intubation, and just moving you from one bed to another, and so on. But I really want in this video as well thank the University of Minnesota.
Yeah.
We were scheduled to do your surgery in a different hospital where the anesthesiologists, they just didn't feel comfortable
Right.
that they can provide the proper service for you.
Yeah.
But the University of Minnesota took care of you
Yeah, I'm
pretty
super-
good, and I had a very good team yesterday.
Good.
And my part was a routine part, but all the periphery as well was taken care of. So I'm happy we could make it work. Yeah.
I really appreciate the extra work that you put in.
Yeah, well, this is what we do. I have done this kind of surgery a lot of time, And on my side, things has become a routine, but it's just not what I do. It's a teamwork, and I had to put the right team together, and so I'm happy we could make it. Your mother yesterday, after I gave him the news, she was happy.
Yeah.
But she told me something that made me really happy. She asked me, how am I doing? How I am doing? And that's, as a doctor, I really appreciate that.
Yeah.
Please thank your mother for that. Yesterday was a long day for everybody, including me.
It was great though.
Yeah, it was a good day. It was a good day. We got the job done. We had a good team.
I thought like when I first got up it was going to be super painful, but it just felt a little strange like the first time, but now it's starting that I'm getting up and moving around more, it's starting to feel pretty normal.
Now, unfortunately, in the United States and globally, this is we weigh risk versus benefit, and the open old-fashioned surgery is a no-no.
Yeah.
Even after 2 hours being on your chest, we had difficulty breathing you, putting air in. In the open old-fashioned surgery, that would have been an 8, 7, 10-hour surgery. Laying on that chest for that long, that would have been a very risky, extremely risky surgery. So those surgeons in Ohio, they was doing the safe thing for you. But it's just that we do the surgery in such a different way that we made a 10-hour surgery, a 2-hour surgery, and the result is the leg pain is gone. You have walked. You're ready to go home. Even in this situation, 1 day after the surgery. And that is my pride, is that we know how to teach it to other people to do that. Hopefully soon, people in your situation don't have to travel that long to get this care.
I certainly hope, and I can't imagine like having it the traditional method after having it like the way that you perform a surgery. Like this is a world of difference from the last incision that I had. Like it's amazing.
And considering that 1 day after the surgery you are actually able to go home, that is unimaginable.
And the last surgery I had, they kept me for 10 days.
So, and that wasn't even a fusion. That was just a laminectomy, which is considered smaller surgery than a fusion. Now we did a 4-level fusion, and well, you have been a great patient. Okay.
Thank you.
And it really pains me that in a situation like that, many of patients in your situation are told, go lose weight and come back, because reality is when you are in pain, you cannot do anything. You are not going to lose weight. You are just going to gain weight. And that is the reality of it. Sometimes we surgeons, we make it easy on ourselves. We just want you to go away because it's risky and we don't want to take that risk. And go lose weight and come back is just to get you out of the door. It's my confession as a surgeon.
Well, and
but no more.
I honestly feel like I have a new lease on life, and now I can actually go lose weight. So thank you. Well, thank you so much. Now, your surgery was not a regular surgery, and it was, when was the surgery again? May 28th.
So about less than 6 weeks ago, right?
Yes.
How long did you stay in the hospital?
It was 2.5 days. Like Friday, Saturday, and left by
so 2 nights.
1 o'clock.
2 nights. And you flew back home, 4 days later after the surgery, correct?
It was 4 days later, yes.
Now, and you're coming from Ohio to Minneapolis to Minnesota. I will share this with my team because your surgery made history. And the reason for that is we did a 4-level fusion, and I'm going to go around here. We did a 4-level fusion for degenerative disc disease, scoliosis, spondylolisthesis, and we did all that surgery in 1 hour and 55 minutes. And
Do I need to look?
and that was a surgery that you have been told by multiple surgeons would be an impossible or deadly surgery. Is that correct? How many surgeons did they tell you they cannot do that for you?
Three different surgeons told me that they would not even consider doing it.
Because they were right. Because your surgery, open old-fashioned way, would have not been a 2-hour surgery, and but we could do it in 2 hours because we didn't go through all the tissue that they had to go through and open up big surgery. Nevertheless, one of the hospitals, even here in Minnesota, refused to put you sleep. The anesthesiologist says you are too big to be put sleep. How much did you weigh at the time of the surgery?
I weighed roughly, I think, around 506 was my approximate weight.
Over 500 pounds, and your BMI was 62.5. Now, the surgery was 6 weeks ago. Tell me, how are you doing?
my back feels amazing. I've had traditional back surgery before where they've cut open and had a large incision. Even from the first day of waking up after when the hospital's like, sit up, get up. I had the first back surgery I had, I didn't move out of bed even when they wanted me to walk. The day after I had surgery with you, I was up, walking, moving around. I didn't have that fear that my spine was going to fall out. Like it felt good compared to the traditional method, and I would recommend this to anyone.
Yeah. And
Doctor,
yes, please.
Oh, excuse me. Someone took a picture and sent it when he stood up the first time. It was truly an amazing picture. It was breathtaking.
Yeah.
Yeah.
And
That was a great day.
And you had to drive or fly from Ohio here to get that, because believe it or not, there are very few people, surgeons in the United States or world, as a matter of fact, are willing to do that surgery, because open old-fashioned surgery is a dangerous surgery. Now, our blood loss for your surgery just was 1.5 ounces,
Minimal.
which is 1/5 of a cup of a coffee, which is nothing. Okay, this is all what we lost to do your surgery, and obviously, still every surgery has its own risk, but doing your surgery with your weight and BMI in that short period of time, with that little blood loss, with that fast recovery, I think there is a news release about your surgery, and I'm thanking you for allowing me to go with this news out there, because believe it or not, you're not the only person having this problem in your situation, and those people now have a choice. So thank you for letting me share your information. Okay?
I just want to say thank you for everything that you've done.
Yes.
Yeah. Well, thank you.
It's very hard seeing your son and seeing my son in his condition.
I know.
And to hear doctors say that we can't help you. I mean, when he went to Riverside, he went to OSU, there was a team of doctors, actually 7 surgeons that had a meeting. 5 said yes, she said no, and unless the vote was unanimous, it was a no. So that was hard, that was very hard. So then when David found you on the internet, and I mean, he did his homework, and I'm like, he's like, Mom, let's do it. I'm like, okay.
Yeah.
Get the paperwork in order, so I could be off work and get his paperwork in order, and but it was encouraging when he found you and he called me.
Well, I'm happy you found me. Healing is still not completely done, but we are on the right path, and I'm hoping that from now on you have more tears of joy than tears of sadness. Okay?
Yeah.
Okay. Well, thank you so much.